Hi, I'm Dr. Joel Cherdak, President of Houston Regenerative Medicine. One of the stem cell procedures that we perform, which very few other regenerative medicine clinics are able to perform, is the stem cell procedure to treat lower back degenerative arthritis of the spine and also disc herniations and bulges of the lumbar spine. Now, these are very painful conditions and they're very common in our population. What patients typically experience is, particularly with degenerative arthritis, is a slower onset. They start to develop pain. The pain doesn't go away, so they may try chiropractic or they may try physical therapy. That may work and solve the problem. If it doesn't, then they've either plateaued or they've not gained any improvement, in which case they oftentimes go to a physical medicine doctor, otherwise called a physiatrist. And what is offered in those clinics is mostly steroid injections to treat the pain. The problem with steroid injections is that the first time that you get them, they may work for several months or up to a year. But each repeated cycle of a steroid injection lasts less and less over time. So it really isn't a good permanent solution. And then lastly, some patients progress to fusion surgery or other types of revision surgery of the lumbar spine, which obviously doesn't have the greatest outcomes for people and can create permanent disability in people, even if it does fix the pain. So I brought our spine model here with us today so I can demonstrate to you exactly what these procedures are and how ours differs. So when I talk about the injections that physiatrists or physical medicine doctors do, they either do what are called facet joint injections. So these are the tops of your hips. This is your lumbar low back spine. In between the vertebrae are the facet joints. And this is where they will apply the steroid. If you've ever heard of an epidural steroid injection, that just means that they're going just above the coating of the spinal canal or the spinal cord, which is here, and they inject it this way, and it goes up the spinal canal, and it treats about L5, L4, L3, L2, and L1, this whole area, relieving inflammation and thus relieving pain. Also, if you've got a disc injury like we see here, then an injection into that area, into what's called the foramen, where the nerve comes out, can help relieve that inflammation, taking pressure off of the nerve, relieving localized pain, and also relieving nerve pain that may be traveling down the leg. A lot of people experience that as well with these conditions. Now, the most common area where people have low back problems are going to be at the L5S1 area, which is here, and the L4, L5 area, which is here. So 95% of lower back degeneration and disc injuries happen in this area. So what we're able to do that's different than using steroid injections and other types of traditional medical procedures is we use stem cells. Now, as I've explained in my previous videos, we have the ability to use either a patient's own stem cells, which we derive from a small bone marrow extraction from the back of the hip, which I described in previous videos, and combine that with adipose or fat-derived stem cells that we extract from a patient's abdomen with a mini liposuction procedure. Now, we also have the ability to use donor umbilical cord stem cells if we think that's going to be a more appropriate treatment for the patient based on their health status, the severity of the degeneration or the disc injury that we're treating, and what we think is going to work the best. So we have many tools in the toolkit in terms of regenerative products that we can use in our stem cell procedure. Now, what we do is we do inject it into the same area. So again, if we're talking about a disc injury, we would be able to inject that combination of stem cells as an epidural injection, like I said, right into this area where it will go up the lower part of the spine and it'll actually come out of the foramen or the areas where you see these nerves coming out and treat this whole area. In addition to that, we also treat the facet joints because oftentimes that's also where the pain can be coming from. So depending on whether it's a disc injury, like we see here, that's pushing on a nerve, or whether it's degenerative arthritis, where the discs have actually disintegrated and the bones are pushing together, putting pressure on the facet joints in the back and also the nerves, we can treat those columns of facets as well. So with our procedure, how it differs from a steroid injection is that not only is it going to initially reduce the inflammation, but after it does that, the stem cells are going to signal to the cells that are there, instead of being in an inflamed state, to start to heal and start to regrow that tissue so that it creates a more permanent solution rather than just the steroids, which just eliminate the inflammation for a short period of time. Now, with our lower back procedure, because the blood flow into the spine isn't as profuse as it is in, say, a hip or a knee, it does take a little while longer for the effects to be noticed. So because we often add exosomes to this procedure as well, we have patients experiencing decrease in pain and increase in function starting at about 3 weeks out. That's when it first starts to become noticeable. Following that, there's improvement over time to where about 5 or 6 weeks out, patients are reporting significant improvements in function and significant decrease in pain. And then that combination of stem cells and other regenerative products that we use will continue to work, particularly the stem cells, will continue to work and help to grow and regenerate new tissue for up to about 6 months. So it really does create a long-lasting solution to these low back types of injuries, and it also doesn't involve, obviously, surgery and the rehabilitation it takes to recover from that. In addition, it's a better choice than steroids because every time you use steroids, like I said, the effects start to diminish each time you do it sequentially. And not only that, but the steroid itself can degrade tissue just because of the caustic nature of the drug. So using stem cell therapy, using exosomes, using donor or umbilical cord stem cells or your own stem cells can get you a great result. We've had plenty of patients that have not even walked into our clinic, that have been rolled in a wheelchair into our clinic, have undergone this procedure, and within a couple of months are able to walk and function without having any surgery. We have countless patients that have been able to avoid surgery. Even small surgeries like discectomies, we're able to help patients avoid those by using our unique stem cell procedure. If you have any of these issues and you have questions about our procedure, click on the link at the bottom of the description of this video, which will take you to our homepage where you can fill out a request for a free consultation. So our patient coordinators will get back to you right away. We'll be able to order imaging if you don't have any recent imaging, and we'll be able to review that with you and tell you what we think the outcome will be without any cost. So like they say, knowledge is power. It'll cost you nothing to go through the process of seeing what we actually can do. And we always try to underpromise and overdeliver so that we get the patients the best possible care that we can possibly provide. So again, reach out to us. We'll get back to you right away. We look forward to hearing from you.